Janet Hill, the Chief Operating Officer at the Rock Island County Health Department. It's a little bit after 3:30 on July 2nd. We are thankful that you are here. We are joined today by a special guest. The Illinois Department of Public Health Director, Dr. Nita Ezike, is here to talk to you about the situation in Illinois and what she and her team have been working on for the last many months. We also will have some prepared comments by Nita Ludwig, the administrator of the Rock Island County Health Department, and Ed Rivers, the director of the Scott County Health Department. But we will take your questions in the chat box. Dr. Ezike will need to leave a little bit early, so if you have questions for her, we do ask that you post them as quickly as possible, and then we can take questions for Nita and Ed after that. Thank you very much. Nita, let's start off with the Rock Island County numbers, please.
Hi, this is Nita. Today, Rock Island County Health Department is reporting 20 new COVID-19 cases, and that brings our total in Rock Island County to 995 cases. We still remain at 29 deaths for Rock Island County, and currently 6 people are hospitalized.
In Scott County, the number of cases as we speak is 696. When we last looked yesterday, it was 651. That's an increase of 45 cases. We remain at 10 deaths in Scott County.
Okay, Dr. Ezike, please feel free to go ahead.
Thank you so much, and thank you for inviting me. I'm so happy to be joining today's press briefing. We have obviously made great strides in our battle against COVID-19, and it's because of the actions of all Illinois residents. So congratulations to you for all of your hard work. Statewide, we have had 144,882 confirmed cases. In the last 24 hours, we have had 869 cases and unfortunately 36 deaths reported in the last 24 hours. We're very proud that we have been able to increase our testing capacity throughout the state and have been resulting for the last week on average 30,000 tests per day. I am cautiously optimistic about the direction we are headed. We have been seeing the numbers of cases decrease and the numbers of people in the hospital decrease overall, and we've been seeing the deaths decrease. But of course, we are not out of the woods. The virus is still circulating, and we still don't have a vaccine or a highly effective treatment that's widely available. So that means that we must learn to coexist with COVID. And of course, that means that we have to limit our interactions with large groups of people. We need to continue maintaining our distance, and we need to keep wearing our face coverings. We are continuing to follow all of the data along with our local health department leads to look at the number of new people who get infected, the people who end up in the hospital, in the ICU. We're looking at the positivity rate, which is the number of positive tests out of all the tests performed. And of course, we're looking for outbreaks and clusters. I do want to caution people and remind them of the importance of staying vigilant. We have created our county level rating system that turns blue or orange if there's some kind of warning, something going on in your county that you need to be aware of. I'm very happy to report that all the counties in Illinois are in blue and remaining on target. We know that several states across the country have seen sometimes dramatic increases in the number of new infections. And so as we've been opening up and gathering in larger groups and having people packed shoulder to shoulder in bars is really a risky undertaking. And so we are continuing to ask people as they start gathering more to please watch your distance, please continue wearing your mask, and please wash your hands frequently. We want to decrease the risk of exposure to this virus for everyone. And of course, Contact tracing is an important part of that effort. Of course, that involves identifying cases and people who come in contact with, who they come in contact with. And of course, this is all to work to stop the spread of the disease. So if you do get a call from a contact tracer, please pick up the phone and please share information so that we can isolate and identify additional contacts so that we can nip the transmission in the bud. If you get a call from someone who's asking for social security numbers or bank account numbers, that is not a contact tracer. That's a scam. And so we don't want you to be taken advantage of, but we still do need the information. Our legitimate contact tracers do need the important information. So through grants to local health departments like our partner Rock Island, additional people will be hired to help the existing public health officials identify people who've been exposed to the virus. We're all in this together. It's because of individuals and their individual behavior that we were able to graduate to phase 4 last Friday. And so we want to use that same smart behavior to stay safe and minimize transmission even as we reopen our state. Please don't gamble with your chances against COVID-19. We want to keep everyone as safe as possible. We know that we've had severe illness and fatalities in people of all ages, races, and people who had no pre-existing medical condition. Please, let's continue to practice the 3 W's of washing our hands, watching our distance, and wearing our face coverings. Together, we will get through this pandemic. Thank you so much.
Thank you, Dr. Ezike, so much for those comments. We greatly appreciate that. We have received a couple of questions for you, which we hope you'll be able to respond to for us. A couple came ahead of time, and then we'll go to a couple in the chat, so you can feel free to pull up your chat box as well. The first one, how close is our region to slipping backwards and being placed under phase 3 or possibly even under phase 2? Are you able to speak generally about the region that Rock Island County is in? Oh, can we get you to unmute? There you go, thank you.
Thank you, sorry. So no, I am happy to report that right now, everybody is in good shape. Some of the parameters and the metrics that we're using to consider reverting back from phase 4 to phase 3 include test positivity. There's no difficulties in the Rock Island area with regards to test positivity. We are seeing numbers consistently well under 5%. Hospital capacity in terms of medical surgical beds, ICU beds, and ventilator capacity are well over the thresholds that would be worrisome. When we look at people being admitted from the emergency room for COVID-like illness, again, no problem. So things are looking good, definitely in the county and in the bigger region as well. So we are hoping that we will stay on this very positive path.
Another question, how does our region here in Western Illinois, Eastern Iowa, but mostly Western Illinois for your piece here, compared to other regions that border other states that have different timelines for closing and reopening in comparison to Illinois?
Yeah, so I have
How much was for?
I'm sorry?
Oh, I think that we needed to mute someone else. Sorry about that. Go ahead with your response.
No problem. So again, we instituted some very aggressive measures early on, and that really helped situate us in a really good position. We were, I think for the Western region particularly, that wasn't as hard hit as the Chicagoland area. So the percentages of test positivity never quite reached those peaks. So we're continuing to follow. I don't have in front of me the exact data for the other, for Iowa generally, but I know that we have been trending downward for months. And so we've been heading consistently in the right direction. And so I think, the good actions and activities that have brought us this downward trend. Hopefully, even as we're reopening, we can maintain those good metrics.
Another question, you may be aware that in our region over here, we have had a decrease in that average age of those who are testing positive towards that young adults. Can you discuss the state's plan to reach teens and young adults to persuade them to follow the CDC guidelines and the IDPH recommendations, the 3 W's as you mentioned?
Yeah, so that's a great point. We really need to, reach all segments of society, and so we need to work closely with our local health department leads to come up with very engaging social media campaigns to make sure that we're getting younger and older audiences to pay attention. We've been trying to put out PSAs. We've been trying to use social media, but sometimes we're not getting our target audience. So we're still working internally to figure out new strategies, and really I'm going to look to the youth group. Part of our one of our work groups came up with the idea of having a youth forum to kind of get feedback from the youth in terms of how they would be effectively messaged to and what kind of messages would resonate. So we're looking forward to that meeting in the next couple of weeks, and hope to glean some very helpful tools so that we can really make sure that they are represented in our messaging in an effective way that will actually make them comport with the behaviors that we want to see.
Thank you. And we do have one final question for you. And this is related to the East Moline Correctional Facility. It says they have roughly 75 inmates and staff positive for COVID. What's being done for prisons in general and East Moline in particular to protect inmates and staff? And how is this being accomplished?
So I have been in regular contact with Director Jeffries of the Department of Corrections, as well as the medical director, Dr. Bowman. So we have been keeping an eye on all of our state facilities and aware of the situation at East Moline. Of course, it's very important to make sure that the facility has enough PPE. And so that is one of the things that is top of mind. They went to universal masking a very, very long time ago, but even with all the measures that have been put in place, of course, we are still seeing cases. So we are working very closely. We have a special congregate care setting work group as part of our COVID response. And so we are working on strategies of testing and strategies around other mitigation plans to try to keep those numbers down for that facility and all of our state correctional facilities.
Well, that was our last question for you, Dr. Ezike. Again, we're very grateful that you joined us today, and we appreciate your support in our community. I'll say that on behalf of both of our county health departments that are on today, both Iowa and Illinois. So we understand you may have to leave the call now. If you're able to continue, feel free to, but we will go ahead and now hear some local comments. So first we can start with Nita. So please, Nita, go ahead.
Hello. So we do have our testing site now operated by the Illinois Department of Public Health, and that is running in downtown Rock Island, and it has been very robust. We're very, very pleased with the site. They have, in their first 3 days, they have completed almost 800 tests. So we've learned a few things since the team has been on site that we wanted to pass on to folks. First, the patients will receive the results, both positive and negative, by a phone call. The results are taking about 3 to 4 days to be reported because of the increased testing. Personnel from the state lab will call the tested patients twice from this phone number, 888-297-7208, and I'll put that in the chat. But they will get a phone call, 2 phone calls from this number, and they will not be leaving messages because of privacy concerns. However, if patients get that call and they miss it, they can call that phone number back to get their results. But they will have to share their name and date of birth to get those test results. And again, they will be sharing whether it's positive or negative. Testing is available every day through July 10th, except for the 4th of July. Hours at that site are 8:30 a.m. to 4:30 p.m., and the site is located at the Quad City Expo Center and that is at 2621 4th Avenue in Rock Island. Due to the demand for the service, there could be significant wait times, so we do ask for your patience. And again, all this information is available on our website, which is richd.org, or on our Facebook page. Thank you, and I'll give it back to you, Brooke.
Thank you, Nita. We'll go ahead next and hear from Ed Rivers, Director of the Scott County Health Department. Please go ahead, Ed.
Well, after several weeks of declining numbers, we continue to see very high numbers that started last week for cases in the Quad Cities. According to numbers released by IDPH today, in Scott County, we will see the highest daily case count today. And additional testing is not driving the spike. Transmission of the illness in the community is driving the spike. A majority of the cases we've seen in the last week have been individuals experiencing symptoms of COVID-19, not asymptomatic people. Based on information gathered in interviews, we're seeing community spread from individuals who become infected and then go to work or attend group activities, and they spread the virus to others they are near. All the coronavirus needs to move from person to person is close proximity and no barriers. We're also finding that some COVID-19 positive individuals have 10 to 20 close contacts. Each of these individuals is now considered an exposed contact of the positive case. And as contacts, they're required to self-quarantine for 14 days to prevent them from spreading the virus should they become infected. Also, recently we've heard reports of shoulder-to-shoulder patrons without masks in bars, businesses requiring employees who have tested positive to come into work, large gatherings at parties without deference to social distancing, business gatherings of large number of people in close quarters without masks. And these are not behaviors that will keep the virus from spreading. We must all take responsibility for the risks we take and we present to others when we're in public places and around others from outside our households. You've heard it from us time and time again that we each have the tools to prevent the spread of the illness. For example, if you're seated in a public place and you aren't 6 feet away from others, ask to be moved. And if you can't be moved, don't stay. If you're at work and you have close contact with others, but you're not being required to wear a mask, wear one voluntarily. If you attend a party or a gathering of friends, just forget about the craziness of things for a while. Know that that gathering has risk, no matter how harmless it may seem. You could be carrying the coronavirus away with you and exposing each and every person with whom you come into contact, your grandparents, your co-workers, your friends, your team, and you might not even know you're infected. We must do everything in our power as a community to get control of this spread now. Yes, establishments in our community are allowed to be open under the governor's most recent proclamation, but even with the establishments taking precautions, each of us as members of the community must do our part to keep distance between ourselves and others. Wear a face covering when we can't, wash our hands often, and stay home when we're sick or have been identified as contact. That's what I have to say. And as a community, we must now come together to stop this spread.
Thank you very much, Ed. It looks like we only had one question that's still left in the chat, so please type in any questions that you may have for either Ed or Nita, and we will get to those. The first one is from WHBF, and we'll have Ed discuss this first, and then Nita, if you have anything to add, please do. We know the holidays are approaching. I'm assuming these are the ones that come at the end of the year based on the question. What are some of the things that families can do while still remaining safe?
Well, were you talking about the 4th of July holiday? I didn't understand your question.
I think any of those where they might be gathering with individuals. It doesn't say specifically.
Well, we've heard, as I mentioned, reports of parties that have been going on with large numbers of people, no mask, no different social distancing. If you're going to be attending a gathering, make sure that you can stay away from people. Preferably have it outside. It's been shown that transmission outside is much less likely than inside for obvious reasons. Don't go if you're sick. If you are around people who are displaying symptoms, stay away or leave. The other things that we've been telling you, wearing masks, washing your hands often, those are still good behaviors to have. But basically, the best thing to do is stay at home as much as you can, make essential trips only, and keep your distance from others.
Would you like to add anything to that, Nita?
Sure, I would just echo those very same comments. And as we get nearer to the other holidays, Thanksgiving, Christmas, Hanukkah, all of those holiday times, we have to remember that we still don't have a treatment or a vaccine. So it's even more important to remember that we still need to do those very same simple things: washing your hands, watch your distance, and wear your face coverings when you have to be in close proximity to people. And ever more important, to stay home when you're ill. You may spread it to others without even realizing it.
Thank you both, Ed, Nita, as well as Dr. Ezike. We appreciate all of your time and information that you're able to share with us this afternoon. We did plan on having the recording of this posted on our website within about 20 minutes. Additionally, information will be provided to the media in the form of a press release. And additional information is being shared daily on social media for other information that would be beneficial to share with the community. So we appreciate your assistance with that. There's one last question, and this was for you, Ed. Just to clarify, did Ed say this was a record number for Scott County, or is it going to be a record day for Iowa? Ed, are you able to clarify that?
Yeah, we're just talking about Scott County.
Yes, this is for a daily total for Scott County in terms of total number of cases. And those throughout the weekend can be found on coronavirus.iowa.gov, the website. So thank you again all for joining us. We appreciate your assistance in sharing these messages with the community, and we will be in contact soon for additional information. Have a nice afternoon.